Hi, I'm Dr. Eric. I wanted to show you how we use the SereniVac and how we put it in the proper position. So there's a few special designs that make this work really well. There is a chin rest, a chin cup, 2 saliva ports. The main suction is coming from the center, and then we have our hood design. So when we're installing this, we're going to want to put it right through the 3-finger clamp. The clamp has 2 separate tighteners. The one is this top butterfly clamp that will grip the HVAC itself. The second one is another butterfly clamp that's going to stop this rotation. So what we want to do is keep everything loose. Put the SereniVac right into the HVAC and get ourselves in the comfortable position where we think we're going to be working, and then we'll tighten everything up. So we're going to get ourselves close. First position is our side profile position. This is really good at creating a suction from the side. There's 3 or 4 different ideal positions that I'm going to show you. So this, you're going to bend the arm, kind of grabbing the arm with one hand as you bend it. That's just going to help take the stress off of the arm. It's very rigid, but you still want to, preserve its lifespan by being careful with it. So as you can see, I got myself in a pretty good position. Ideally, we want to create a nice tight fit up against the cheek. That's going to help increase the suction and prevent you from pulling unnecessary air from under the chin. This is going to help us focus on getting the aerosols. So once we have ourselves into that position, we have a nice tight seal. We're going to start tightening up our clamps, and they can go pretty tight. Then we'll go ahead and tighten the other butterfly clamp. And you can see we have pretty good position there. And we also have the opportunity to rotate freely here to make sure we have a nice clamp. This does have a lot of support to it, so you can use that as a finger fulcrum if you're doing hygiene. Our next position that I really like, I'm going to loosen everything up a bit, is the under the chin or over the chin mount. So we either want to kind of come up here, sitting over top, or we can sit underneath, depending on which position you're more comfortable with. Can you open, please? And you can see we're going to get a nice tight seal up against the lips. So I'm just going to keep us in this position and then tighten everything up. So again, you want to get yourself in the position before you tighten. So now we're going to tighten up here. And you can see, gave us a real nice seal up against the chin. So all the aerosol when you're working down here is going to get caught inside that hood and get sucked right out. Now our next position that a lot of our hygienists prefer is to come up from a little bit high, whichever side you want to work on. Again, we're going to loosen everything up, and we're going to insert a saliva ejector in. So the saliva ejector gets injected about halfway in, then it's going to get really nice high volume suction out of this because it's hooked up to an HVAC line. So we're going to come in close again, everything's nice and loose, get ourselves into a position that we think we're going to want to work at. And once we're in that position, now we can go ahead and start tightening things up. Okay, and that's a good position for hygienists to work. So get really great suction coming from that position. You can even hear it. Now my final position, this is more of a dentist working by himself. We like to call this next kit the Solodentist kit. And I've already pre-bent my saliva ejector, but typically what you're going to want to do when you're setting it up, bend it towards the midline, and then just kind of come up, and then we would install this special design bite block. So we're going to bring this in, it's already pre-bent. The bite block just clips here, you pull through, it fits right in. Patient's going to kind of just hold it lightly, just to prevent it from pulling on their cheek. Okay, open please. Open nice and big, good. Bite down, and you'll have them lift their chin just a hair, good. Drop the hand a little bit, And you can see that's going to give us that exact same really tight seal up against the cheek, giving us really good suction from the bottom. And because we have such high volume suction coming out of the saliva ejector, patient stays really dry at the same time we're catching all this aerosol. And you can see when we turn it on, we're getting really a lot of power pulling through it. So personally, as a dentist, this is my favorite. Hygienists love the other three, but it's pure preference, so you can use whichever mode you're the most comfortable with. And open, and you can see really easy insertion, comes out really well. Patients are comfortable. Enjoy.